it really does require thoughtful communication and preparation because, as clinicians, we're excited for our patients as they're getting near the end of their treatment, but just recognizing, and in some cases, they've been with us for over a year, if it looks at from, diagnosis throughout treatment, if they receive multimodality treatment, chemo, radiation, surgery, etc. So there really needs to be a clear follow-up plan for individuals to follow. So as oncology nurses, our role is a lot of education as to what to expect. And also, too, there needs to be clear follow-up plans back with the individual's primary care provider, because they've spent so much time with the oncology treatment team, they're going to go back to their primary care provider. And that may be a source of a little concern, like, wow, do they really know about everything that I've been through? Do they know, if I have this experience, how will they monitor that? So, we really need to provide clear guidance to primary care providers as well. One of the ways that we try to do that is with a follow-up plan that we put in place, like a survivorship care plan in summary that's given to the individuals with cancer and also back to the primary care provider in collaboration with the oncology treatment team. One thing that, we have noticed with that though, and I'll just point that out to others, is that, there may not be a clear plan, so to speak, when those guidelines change. So, we really need to take that into consideration as clinicians. If guidelines, change because we know more, who is going to update the individual primary care provider if they're not seeing them as frequently? So, those are some things that we really need to keep in mind as clinicians is to ensure that those our primary care providers and our patients are aware of these guidelines. And sometimes that can be helpful with, transitioning into like a support program, even if peer navigators are involved, as well as, there's not a lot of guidance for primary care providers in relation to how to provide that specific cancer specific follow-up care. So, I think we, need to work better together to have that team approach to survivorship care. If it's between, an oncology nurse, advanced practice oncology nurse, the medical oncologist, and the primary care provider. So we're all on the same page when we're meeting with the patient. And that helps build that trusting relationship with our patients and survivors as they're, transitioning, back to their next normal, whatever that means to the individual as well. So just having that tailored approach to care because not everyone with cancer, has just a cancer diagnosis. As the individual with cancer, we see that, when as the age, the incidence increases, so they may have heart disease or diabetes. So we really need to have that holistic care available to individuals because they're not just a cancer survivor. They have other health conditions that we need to manage in addition to their follow-up care because they have had treatment for a cancer.